Sick sinus syndrome is an cardiovascular disease condition. Look at this picture, shows that heart with normal electrical signals and heart with disorganized electrical signals. Look at this. Then ECG findings. Look at this. Detail going on. Introduction. Sick sinus syndrome, also known as sinus node dysfunction, is a group of heart rhythm disorder caused by malfunction of the sinus node, the natural pacemaker of the heart. This condition often results in irregular heartbeats, either too slow, bradycardia, too fast, tachycardia, or alternating between the two, tachy or brady syndrome. It commonly affects the elderly but can occur at any age, especially if there is underlying heart diseases. Definition. Sick sinus syndrome is defined as a collection of arrhythmias resulting from abnormal sinus node function, leading to inefficient heart rhythm and compromised cardiac output. Etymology. The term sick sinus syndrome originates from the malfunction of the sinus node, also called the sinoatrial node, the heart's natural pacemaker. The word sick is this context refers to the dysfunction or abnormal activity of the sinus node, leading to irregular heart rhythms. Epidemiology. Sick sinus syndrome is most commonly seen in the elderly population with the age average of a diagnosis around 68 to 75 years. It accounts for approximately 50% of permanent pacemaker implantations, and its incidence increases with age. affecting 0.17 to 0.42 per thousand people annually, with a higher prevalence in women than men. Types: 1. Sinus bradycardia, persistent slow heart rate less than 60 bpm. 2. Sinus arrest or pus, sudden stopping of the sinus node activity. 3. Sinoatrial block, failure of the electrical impulse to excite the sinus node. 4. Tachybrady syndrome, alternating episodes of fast and slow heart rates. 5. Chronotropic incompetence, inability of the heart rate to increase appropriately with activity or stress. Causes: 1. Degeneration of the sinus node due to aging. 2. Ischemic heart diseases. 3. Myocarditis or cardiomyopathies. 4. Cardiac surgeries, especially involving the atria. 5. Hypothyroidism. 6. Medications. Example: beta blockers, calcium channel blockers, digoxin. 7. Genetic mutations, rare in familial forms. Risk factors: 1. Advanced age, most common in elderly. 2. Hypertension. 3. Coronary artery disease. 4. Previous myocardial infarction. 5. Heart surgery. 6. Use of medications that slow the heart rate. 7. Infiltrative diseases. Example: sarcoidosis, amyloidosis. Complications: 1. Syncopes, fainting. 2. sudden cardiac arrest. 3. Heart failure. 4. Stroke, especially in Tachycardia syndrome. 5. Reduced quality of life due to fatigue or palpitations. Pathophysiology. The sinus node located in the right atrium initiates electrical impulses that detect heart rhythm. Pathophysiology of sick sinus syndrome, step by step process. 1. Normal sinus node function. The sinoatrial SA node located in the right atrium initiates electrical impulses that control heart rhythm. It sets the pace of the heart by generating regular, spontaneous electrical activity. 2. Sinus node dysfunction begins due to aging, ischemia, fibrosis, or infiltrative diseases. The sinus node becomes damaged or degenerates. The node's ability to generate or conduct impulses becomes inconsistent or inadequate. 3. Impaired automaticity. The sinus node fails to generate impulses at a normal rate. This causes sinus bradycardia or sinus pus or arrest, a slowing or temporary stop of heart rhythm. 4. Conduction block within or around the SA nodes. The impulse may be generated but fails to excite the sinus node or gets blocked on its way to the atria. Sinoatrial block. This results in missed beats or pulses in rhythm. 5. Escape rhythms and ectopic pacemakers. In the absence of impulses from the SA node, secondary pacemakers, example AV node or Purkinje's fiber, may take over, producing an irregular rhythm. 6. Development of Tachycardia syndrome. In some cases, the sinus node alternates between periods of bradycardia and tachyarrhythmia. Example, arterial fibrillation or flutter. This can lead to ineffective cardiac output and increased risk of thromboembolism. 7. Reduced cardiac output. Irregular or slow heart rates impair ventricular filling and blood ejection. This leads to symptoms like fatigue, dizziness, syncope, and potential progression to heart failure. 8. Compensatory mechanisms fail. The body attempts to compensate, example, increased symptomatic activities, but over time these mechanisms become insufficient. The condition may become chronic and progressively worse, requiring pacemaker intervention. Signs and symptoms: 1. Fatigue. 2. Dizziness or lightheadedness. 3. Palpitations. 4. Syncope. 5. Chest pain. 6. Dyspnea. 7. Confusion or memory problem in elderly. Diagnosis: 1. Electrocardiogram ECG to detect arrhythmias. 2. Holter monitor 24 to 48 hours continuous ECG recording to capture intermittent symptoms. 3. Event recorder or implantable loop recorder for long-term monitoring. 4. Exercise stress test to evaluate chronotropic incompetence. 5. Electrophysiological studies EPS for precise diagnosis in complex cases. 6. Blood test to rule out metabolic or endocrine causes, example, thyroid function test. Nursing diagnosis: 1. Decreased cardiac output related to dysrhythmia. 2. Risk for injury related to syncope episodes. 3. Activity intolerance related to fatigue and bradycardia. 5. Fear, anxiety related to palpitations and uncertainty of disease progression. 6. Knowledge deficit regarding disease condition and management. Medical management: eliminate or adjust causative medications. 1. treat underlying conditions, example hypothyroidism. 2. Anticoagulants in patients with atrial fibrillation to prevent stroke. 3. Implantation of a permanent pacemaker, mainstay of treatment in symptomatic bradycardia or tachybrady syndrome. Nursing management. 1. Monitor heart rate and rhythm regularly. 2. Administer prescribed medications and monitor for side effects. 3. Educate patient about symptom monitoring and when to seek help. 4. Assist in pre and post care of pacemaker implantation. 5. Promote safe environment to prevent falls from syncope. Treatment options. 1. Permanent pacemaker for bradycardia or symptomatic SSS. 2. Rate controlling medications for tachyarrhythmias used cautiously. 3. Antirhythmic drugs in selected cases, usually after pacemaker insertion. 4. Anticoagulants to reduce the risk of thromboembolism. 5. Lifestyle modifications. Avoid dehydration, excessive alcohol and stimulant drugs. Psychosocial medicine. 1. Psychological counseling to reduce anxiety, depression and fear of cardiac events. 2. Support groups for peer support and shared experiences. 3. Patients and family education on condition, device care and lifestyle changes. 4. Stress management techniques, yoga, meditation, breathing exercises. 5. Vocational support helps in adapting to work or lifestyle changes due to limitations. Prevention. 1. Regular cardiovascular checkups, especially in older adults. 2. Control of risk factors, hypertension, diabetes, coronary artery disease. 3. Avoid drugs that can depress sinus node function unless absolutely necessary. 4. Monitor and treat thyroid disorders promptly. 5. Educate at risk individuals on early warning signs. In conclusion, sick sinus syndrome is a significant but manageable cardiac condition that primarily affects the elderly. Early recognition, appropriate use of diagnostic tools, and timely intervention such as pacemaker insertion can significantly improve quality of life and reduce complications. Managing symptoms, educating patients, and preventing injury. A multidisciplinary approach, including psychosocial support, ensures comprehensive care and better outcomes. Thank you. Have a nice day.